My patient is a 65-year-old female whose initials are RH, and she is a retired teacher and is currently not married. The signs and symptoms that she was experiencing when she got admitted to the hospital were difficulty breathing, a projective cough that was thick and yellow, and a fever of 100 degrees Fahrenheit. She was then diagnosed with Staphylococcus aureus pneumonia. Her past medical history includes chronic mixed respiratory failure, end-stage COPD, type 2 diabetes, hyperlipidemia, and Parkinson's disease. She had a tracheostomy surgery in December of 2017 to place a permanent trach in her throat, and she also had a splenectomy in May of 2014. She has a family history of type 2 diabetes, breast cancer, and stroke. Her medications include Lipitor, Lovenox, famotidine, Lantus, prednisone, Cineplus, and vancomycin. The drug that I am focusing on is vancomycin. Vancomycin is the generic name, and the trade name is vancomycin. It is classified as an antibiotic and is in the class of glycopeptides. The MOA of this drug is that it inhibits transpeptidation by binding to the cell wall of the bacteria. It also causes bacterial cell death. The half-life of vancomycin is 3 to 11 hours. This drug is delivered through her IV, and the dosage is 500 milligrams every 6 hours, which she tolerates well. It is indicated for the treatment of Staphylococcus aureus pneumonia, which is her diagnosis, as well as C. diff, pseudomembranous colitis, and Staphylococcus enterocolitis. Some adverse reactions of this medication are hypotension, nausea and vomiting, rashes, phlebitis, and back and neck pain. The life-threatening adverse reactions include nephrotoxicity, which can lead to renal failure. The labs that should be monitored are urine-specific gravity, BUN, creatinine, white blood cell count, and a urinalysis to determine if there are casts, albumin, or cells in the urine. Patient teaching includes teaching the signs and symptoms of hypersensitivity, vertigo, and hearing loss, the signs and symptoms of phlebitis, and the signs and symptoms of hypotension, along with how to report them to their healthcare provider. The nursing implications include monitoring the IV site, monitoring their blood pressure throughout infusion, and monitoring intake and output, as well as monitoring for signs of anaphylaxis.